So Coolsculpting is a non-invasive treatment that we can use to permanently kill fat on unwanted areas. So an ideal candidate for this would be somebody who is preferably within about 20 to 30 pounds of their ideal body weight, who has just maybe an area or two that is resistant to diet or exercise. So oftentimes I'll see a woman come in who will say, even when I am down to 120 pounds, I still have this right here. So genetically what that tells us is that person genetically stores more fat cells in that area. So what we can do with Coolsculpting, it's really the first thing besides liposuction, where we can go into an area and permanently alter the number of fat cells that somebody has. So going forward, if you did gain weight afterwards, our bodies are unable to regenerate new fat cells. What can happen is they can still expand in size, but you're still gonna notice that you just won't notice it as much in those areas if you were to gain weight. Contraindications for Coolsculpting would include if a woman is currently pregnant. Nursing would be a precaution. That would be something they might want to discuss with their doctor. If you have any diagnosed extreme sensitivity to cold, such as cryoglobulinemia or paroxysmal cold hemoglobinuria, or if you have had any recent surgeries in the area we're treating, we don't want to treat over new scar tissue, as well as if you have an umbilical hernia, we cannot treat around that. So the beautiful thing about Coolsculpting is that it's kind of a one and done. So depending on what the consultant and that patient will determine is appropriate for their treatment plan, some patients that might be just doing one treatment, some people that might be doing up to 2 to 3 times. So what that'll look like is the patient will come in for their treatment. If it was just the one application that was determined they might need, that's all they do. So they basically go home, they can continue on with any activities as they choose to, there are no restrictions, and then they just come back for follow-ups afterwards. Right, so Coolsculpting works, so it's using a technology called cryolipolysis, which is just a really fancy term for freezing the fat cell to death, basically. So what we do is we use a non-invasive vacuum applicator, so it grabs onto the tissue, it pulls it away from your body to isolate it, it then delivers controlled cooling for anywhere from 35 to 75 minutes, depending on the treatment area. What internally will go on there is those fat cells will freeze, the lipids inside of them will then crystallize, meaning those fat cells no longer have a way to keep living. So within about 1 to 3 days after the treatment, those fat cells will collapse and then die. Now after that point, we have cells in our body called macrophages that are part of our lymphatic system that will come in and just slowly start clearing those fat cells out through our waste. So it does take a few weeks typically to see the results. 3 weeks would be the soonest you would be able to see a difference, with the most dramatic results occurring anywhere from 6 to 12 weeks typically, depending on the patient. All right, and a fun tip or fact about Coolsculpting is that it was actually discovered at Harvard. So back in 1999, there were 2 world-renowned physicians who had picked up on 2 separate observations where they noticed there was a relationship between the fat in our bodies and the cold. And so the first study was from the 70s. It was called popsicle paniculitis, where there was a study of a mother who had brought their child into the doctor after they had developed dimpling on their cheeks that hadn't been there before. What this doctor had found was that this child had been sucking on a popsicle for prolonged periods of time, and the prolonged exposure to the frozen popsicle was killing their fat in the area, leaving a dimpling effect. Another 10 years later, there was a similar observation called cold equestrian paniculitis, where horse riders in the winter months had been documented to have been losing fat in their inner thighs from being pressed up against a frozen saddle for hours or days on end. So then you fast forward to 1999, these 2 physicians then think, well, obviously there has to be a correlation between the 2, but at the time they didn't know what it was. So they then went on and put in about 10 years of research behind it. And what they found is that our fat cells in our body are very sensitive to temperature, but extremely sensitive to cold. So they thought at that time, if we can find a way to deliver controlled cooling to an area, we can permanently kill your fat cells without harming anything else, because there's a very small window, but at that exact temperature, your fat cells will die, but at that same temperature, your skin and your muscles and your organs are all left completely intact. So when you really think about it, it's a pretty remarkable technology.